Welcome to the Doctor's Show, where doctors drop the white coat and talk real. So today we have with us Dr. Himanshu Matalia, who is a refractive convener and a mentor to many ophthalmologists out there. Hello, sir.
Hi.
It's really nice to have you here.
Thank you. Pleasure is mine.
So, sir is a teacher to many ophthalmologists, and let's ask some fun questions related to it.
Wow, that's difficult. Okay, let's see.
So, what's your most cool teacher moment?
Wow. So being in a teaching place, I guess there are a lot of cool teacher moment which come. So uh, one of them was one of my very dear student. She called up and she said, "You know what? Whenever I talk to my patient, I always remember you, and I've kept one photograph of you in my chamber. And whenever any patient comes which is complicated, I look at your photograph and I thank you." And that's like, it sounds like I'm some old guy and who's hung on the wall kind of thing. And it certainly gives pleasure to your heart that you're fondly remembered by everybody. But it also puts some responsibility in your hand that you have to lead by example. So many of times such kind of cool moments make your heart warm, but also brings a lot of responsibility.
So sweet. Okay. So, what's harder, refractive physics or giving life advice?
Life advice, of course. I don't think I'm any guru to give anybody life advice because everybody's life is so different and we feel that we know everybody's life. But I guess refractive is much easier.
Much easier. Great. Okay. If refractive surgery were a subject, what grade would students usually get?
In the beginning, big zero.
Oh my god.
Because we don't teach them in the big. It's very sad that we keep it as an elite subject and we want to teach them at the end, whereas refractive surgery is very simple and it should be taught in the beginning rather than leaving it for last part of things. So I wish that the training includes refractive training every time. But the interesting part is once they are trained, they are absolutely best in refractive surgery much earlier than any other surgery. So when they finish everything, yes, they are the aces. When they start, no, sorry.
Great. Okay. What's the funniest doubt a student ever asked you?
I would say an embarrassing doubt. I'm fond of perfumes. So one day when student came and said, "Sir, can I ask you one question?" And I thought you'd ask some complicated question. I said, "Sure." I said, "Which perfume you are wearing?" It's like, and this in front of everybody, and it's like, okay, sorry. But yeah.
Great. Okay. A sci-fi gadget you wish existed in eye hospitals.
So a sci-fi gadget which is like a virtual, and I'm sure the day may not be very far, where we have the virtual secretary or your AI agent, which is right next to you, narrate everything, prints out summaries, your appointments are blocked there, reminders are kept there. So a small little AI secretary who reminds you for everything, including birthdays of your spouse.
So, sir, in this era of ophthalmology, what is the role of AI?
Wow. So, not just ophthalmology, every part of our life would get affected by AI in a better way. What happens is we all are tuned to recognize patterns and we recognize things, whether it's ophthalmology, whether you're looking at your reports, topographies and everything, we recognize patterns. But when things are at beginning where there are no patterns which are there, it's very difficult to recognize. Where you have to collect too many data, our brains may not recognize that. And that's where AI is going to bind everything together. AI will make our life much easier by going a step before patterns are developed. May it be somebody who is constantly doing some mistake. Imagine you have a person, imagine you have an employee who is constantly doing some mistake. You're waiting for that pattern to occur, and then you possibly reach out to that. But your AI will predict that person, that you know what, this person is going to behave like this thing. Similarly, your patient has some problem, your AI will be able to predict that outcome or problem before it actually is blown up to the level where it requires treatment. So I'm really excited. We are living in amazing time where AI will make our life much better. And let's not worry about AI causing a problem to us. Much before that, we will have better life thanks to AI.
We also in this era of Googling everything, can people self-diagnose them through internet?
Sure, they can, and they might do that more in future. But what's going to happen is it brings them brings little more awareness in them. So I feel happy when people come to me where they've read about things. It reduces my work actually. When I ask them, "Have you read about it?" and if they sheepishly say yes, I feel happy. I said, "Thank you. You saved my so much time. I don't have to go to the basic level of explaining them everything." So sometimes it is useful. Sometimes they may bias you by putting things in your mind. Well, that's where our role comes, where we explain to them everything and we make them aware of pros and cons of everything. So I don't mind if my patient reads about it, and I'm very happy about that.
That's great. That's great. Rapid fire. Students or lasers?
Students,
Yeah. Viva exam or OPD rush?
OPD rush.
You love
No way.
OPDs.
Of course. I love interacting with people. I love when there are so many people around me, and I just love it. Yeah.
One word to describe new generation doctors.
Oh, cool, intelligent, fidgety, and still very cute.
Great. So now we have a fun finish the sentence part.
Okay.
I'll start a sentence and you can take over.
Hmm.
Being an eye doctor is like?
Oh, it's like Superman. You can do everything clean job and come out victorious, and yeah, very nice.
I wish patients understood that.
That we also have our lives. We also deserve some break. Our time is equally important.
Yeah. The one thing I hear every single day in OPDs.
Oh, one thing I hear every single day in OPD is gratitude from patient. Thank you, and because of you, my vision is so good. And I'm so. Sometimes it's scary. It sort of kicks in that demigod phenomenon in you, and you may become a little arrogant. But I try to keep myself grounded by reminding that's my duty. I'm not doing anything great for you.
So sweet. Okay. What's the funniest home remedy you heard for an eye problem?
Oh, funniest home remedy. Well, one of my patient said that he had prepared some concussion of medications, and I thought he would say that I put it in the eye or something. But that concussion of medication, he said, and using multiple herbs or something, and he said I would apply it on my face and I get rid of dry eye. And I was like, come on, man. I mean, that cannot happen. So people do come out with many of such kind of thing, more so in previous generation, but younger generation much smarter.
If I could make one eye care rule mandatory for everyone.
Sure, but that's very interesting. One eye care rule which I would make mandatory to everyone would be avoiding direct and indirect eye rubbing. Eye rubbing is something which is really sinister. Direct eye rubbing is this, rubbing your eye with your knuckle or with your hand, and indirect eye rubbing is your sleeping position. So by sleeping, if you have habit of keeping your hand on your eye or upside down pillow pressure on the eye, that itself can cause so many problems in ophthalmology. To name few is keratoconus, post LASIK ectasia. So no, that's the worst thing which you can do.
My go-to stress buster after OPD is?
OPD is never stress. My stress buster is OPD. So
Great.
I never get stressed out in OPD. I just love seeing my patient, and I don't need stress buster for OPD.
Beautiful. The most satisfying part of eye surgery is.
Most satisfying part of the eye surgery is you can see the results immediately. You can see the result next day, and next day you know you nailed it. Yeah. So yeah, that's the best part. You don't need to wait for long. When
You
the
always
results,
nail it, sir. And
most
that's
of the
that's
time, yes.
beautiful. Okay. So the last two most important questions that we find out is, if eyes could talk, what would they complain about the most?
They would say, "Man, blink. All you have to do is just blink, blink, blink." We have habit of staring at the thing, and especially more so with the active lifestyle, like mobile phone systems and all those things. Our blink rate goes down, and hence, yeah, I would say just blink.
Great. And the last is, have you ever tested your own vision for fun?
Oh yes, I do that, and I realized that one of my eye has one cylinder which is uncorrected. So when patient can read, which I cannot read, I feel so happy.
That's great. It was a really insightful session and it was really nice
Thank you,
having you,
thank
sir.
you, pleasure
Thank you
was mine.
so
Thank you.
much.